The majority of donors make a full and uncomplicated recovery following donation. However, there are times that additional support may be needed. What can I expect emotionally after donating a kidney? After donation, living donors often report a range of mixed emotions, from joy and relief to anxiety and depression. The process of getting through the pre-assessment and evaluation phase and then surgery can be all-consuming, that donors do not always have time to process everything they are feeling. It is normal for these emotions to come to the forefront after the donation and transplant take place. Living donors generally rate their experience as positive. However, concerns about the recipient's outcome, if you're donating directly to someone you know, as well as worries about the donor's recovery, can contribute to feelings of anxiety. And some donors report a feeling of a letdown afterwards, or post-donation blues. Feelings of depression among living donors are not uncommon, even when both donor and recipient are both doing well. The majority of donors cope well with surgery and the post-operative recovery period, using their general coping mechanisms to good effect. Even if living donors do report some initial change in their mood and feelings of anxiety, many will start to feel like their normal selves within a few weeks. Some studies have reported a small percentage of donors can experience difficulties with depression and anxiety, family conflicts, concerns about negative financial consequences of donation, or about the negative impact on their health. Plus, they may have regrets over their decision to donate. Such difficulties are more likely to happen when a living donor has had a longer recovery time than expected, or the outcome of surgery did not go as planned for the recipient, or the living donor had some uncertainties about donating in the first place. Other people who can be more at risk are those who have previous issues with anxiety and depression. This is why it is really important for the transplant team looking after the living donor to consider their psychological readiness ahead of transplant. If you find that you're struggling with mixed emotions at any time after you donate, you should let your transplant team know how you're feeling during your follow-up visits. It may be that they recommend for you to have an appointment with a psychologist or psychiatrist within the transplant centre, or direct you to support services more locally.